cardiovascular pathology, aortic dissection. All right, so before we start with anything, I just want everyone to understand what an aortic dissection truly is. They define it in the book as just a longitudinal tear within the aorta that forms a separate lumen than what the blood should actually go through. And that might be a little confusing right now, but the best example that I can give to kind of portray what's going on is think about a straw within its wrapper, okay? So the normal lumen is just within the straw, okay? But let's say that new lumen that we've created is between the straw and the wrapper. Okay, so it's not like we're bleeding out into our cavity and we've completely ruptured our aorta. That's not the case. It's bleeding and it's making a new lumen. Okay, so think of it, that example once again. It's between now the straw and the wrapper, whereas it should only be within the straw, the blood. Okay, so that's kind of the best way that I can make it visualized for everyone that's kind of listening online. But another thing, as it continues, right? So as my heart beats every single time, the blood's going to be shooting into the false lumen as well as the true lumen. And as it keeps on hitting the false lumen, it's separating further the aorta from its wall, right? So it's making that intimal tear, that false intimal tear, larger and larger with every single beat. So that's why we have to treat this quickly, and it's very, very deadly if we don't treat it quickly. Okay, now let's get into the important aspects of this. Now, how is the patient going to present? This is how I love to start all these off. How does a patient present? This is the classical presentation. If you see a patient, sudden onset, severe, ripping, sharp, tearing chest pain, okay? That's what they love to say, sharp tearing in nature. Severe chest pain, sudden onset, randomly, okay? They're sitting in church or they're sitting at a restaurant, boom, random. They usually pass out because of how severe it is, okay? And then they can potentially have, and most of the time in the questions, they will give you upper extremity blood pressure differences. So there's a asymmetry between the blood pressure in your right arm and the blood pressure in your left arm. Now, that doesn't always occur because it depends on where that intimal tear is occurring, right? Depends on if it's after or before our brachiocephalic or after, right? Now, what we need to know, okay, so that's the first thing. That's the presentation. You got to get that down. And if you see it, you're going to love it, right? You can say, all right, sweet. I know it's an aortic dissection. Now let's get down to the questions that they might ask. Okay. First one, the association is with hypertension. Okay. This is the most important risk factor. Now, I already gave you two important risk factors that have hypertension. One, aortic dissection is that first one. And two, we already talked about thoracic aortic aneurysm having hypertension as an important risk factor. But I will say hypertension is the most important risk factor for aortic dissection. Think of that. Think of hypertension for aortic dissection. Okay. Now, number two, something that they like to ask about is connective tissue disorders. As we talked about with the thoracic aortic aneurysm, Marfan syndrome, once again, has an increased risk for aortic dissections. Okay. So be aware of that. Make sure you understand it. Okay. Now, what they'll say is that the patient will have cystic medial degeneration also present here. Okay. And you get fragmentation of the elastic lamella in the aortic media. Okay. So as I explained it, right, they liked to use fancier words than I did, right? I used the straw analogy, but the way that they will actually say it is fragmentation. Okay. So breaking of the elastic lamella. So the elastic layer, which is in the tunica media. Okay. And in the aortic media, boom. All right. So that's how they'll present it as. It's very confusing, but if you break down those words, then you know what they're talking about. And as I said already, there's cystic medial degeneration also seen here as we saw it within the thoracic aortic aneurysm. All right. Now, another thing, they can present with chest x-ray showing mediastinal widening, although it's not really as high yield or as important. Okay. Now let's kind of break down the aorta first and foremost. So off the aorta, we have three arteries that come off. We have the brachiocephalic trunk, okay? The first thing that's coming off on the right side, okay? Then we have the common carotid, the left common carotid, okay? And then we have the left subclavian, okay? And so it depends on where we have our aortic dissection, right? If it's after that left subclavian, then my blood pressure is going to be equal in both my right and left arms, because both my right and left arms aren't going to be having the differences with the tear. The tear is not near those areas. However, if the tear is located within or between, affecting one or the other brachiocephalic trunk, which gives off the right common carotid and the right subclavian, compared to the left common carotid and left subclavian coming right off the aortic trunk, then we will have differences in blood pressures, okay? Now, these are differences in blood pressures of the upper extremity. That's very key because there's going to be another pathology that shows a difference in extremities of the upper and lower extremity. This is just a difference in extremities between your right arm and your left arm. Okay. Now, there's two types that they like to differentiate the aortic dissection. To me, I don't care. Okay. What I want you to know is this. The first thing is that you have a potential for getting cardiac tamponade with an aortic dissection. Okay. It's kind of confusing to kind of describe that because we don't know what cardiac tamponade is yet, but you'll come across it later. But all cardiac tamponade is that we have blood between the heart and its sac, the pericardial sac. Okay. So blood is filling in that area between the heart and pericardial sac. And so that doesn't allow the heart to beat as well because it can't fully expand because there's fluid in that area. Okay. And in this case, it's blood. Okay. And the reason that this can cause it is because the intimal tear can go all the way back down towards the pericardial sac and open it up, right? And tear through and start bleeding within the pericardium, right? Between the heart and the pericardium. Okay. So I hope you understand that. And that's where it becomes very, very deadly because it can cause shock and a decrease in cardiac output because our heart can't squeeze as well. Okay. You have to treat them with surgery. Lastly, there are some things that we can treat them with. You can give them a beta blocker and then vasodilators, okay, for only descending aortic aneurysms. But really, that's not as important, okay? So overall, what do I care about? Here's what we need to know about aortic dissection. One, it's a fragmentation of elastic lamella in the aortic media, right? So you're just making a new lumen, okay? You're going to see cystic medial degeneration here, just as we saw in thoracic aortic aneurysm, okay? Hypertension is the most important risk factor for this, as well as thoracic aortic aneurysm, right? You can see it with Marfan syndrome, and the patient's going to present with this sudden onset severe chest pain that is sharp and tearing in nature, okay? They're going to have potential upper extremity blood pressure differences between the right and the left arm, depending on where your aortic dissection occurs, and it can progress to cardiac tamponade, leading to shock and death. All right, so that's it. If you have any questions, let me know, but this is a very important thing that you should understand.